guys, this is Dr. Hub. Today we're going to look at the anti-glaucoma and the anti-glaucoma drugs. So the focus is on the mechanism which lowers lowering the IOP, that is the intraocular pressure. So first is the drugs which increase the trabecular flow, outflow. So drugs which increase the trabecular outflow. So this includes, there is a miotics. So the miotics, it includes the pilocarpine. So miotics includes the pilocarpine. Next comes the epinephrine. So the epinephrine as well as the dipivefrin. So all this, it increases the trabecular outflow. There is also the bimatoprost and the rho kinase inhibitor. So there is a rho kinase inhibitor. So it includes a netazerdil. Next we move on to the drugs which increase the uteroscleral flow. So the drugs which increase the uveoscleral outflow. So what increases the uveoscleral flow? It is the mnemonic PEBA. So P for the prostaglandins. Next comes E for the epinephrine, and there is epinephrine as well as a dipivefrin. Then comes B for the brimonidine. There is brimonidine, and A for aproclonidine. Now we saw the increase in the uveoscleral flow. Then we'll be looking at the drugs which decrease. So the drugs which decreases the aqueous production. So what is the one which decreases the aqueous production? It can be the carbonic anhydrase inhibitors. So carbonic anhydrase inhibitors, as we know, it is the, to name a few, it is acetazolamide, as well as it can be the dorzolamide. Next we look at the alpha receptor. So alpha receptor, what does is it stimulates the ciliary process. So there is stimulation. So it stimulates ciliary process. And the example here is nothing but there is a epinephrine. Then there is a dipivefrin. Then there is also the clonidine, brimonidine, as well as the aproclonidine. Then comes, there is a beta blockers. So all this is the one which decreases the aqueous production. Lastly, we look at the hyperosmotic agents. So what are the hyperosmotic agents? So hyperosmotic agents, it includes, there can be glycerol, then there is also the mannitol and also the urea. So all this comes under the hyperosmotic agents. So this was all about the anti-glaucoma drugs, the mechanism of lowering the IOP. To learn and grow daily like this, please do subscribe.